I'm Jason Miyares, Attorney General of Virginia. I think the fentanyl epidemic is both a national security challenge and a domestic challenge, unlike any that we've seen in this country. We were losing at the peak 105,000 Americans on average every 12 months to addiction deaths. And to put things in perspective, we lost 50 some thousand Americans in the Vietnam War over the course of 15 years. So it was two Vietnam Wars happening every 12 months in this country to absolutely devastating impact. Virginia was not lost on that. And so we really in Virginia took a very, very specific approach. First of all, the Governor Youngkin and I have an attitude. If you can measure it, you can improve it. So we wanted a variety of metrics to be able to both track and see. And what we quickly realized is we have to both disrupt supply, we have to disrupt demand. Okay. And on the supply side, it meant going after these dealers. We launched several significant operations that we went after these fentanyl dealers and got a record amount of fentanyl off our street just in the last 18 months. And then we also launched Operation Ceasefire, which was targeted our 13 most violent cities. So much of the violence that fuels our cities are related to drug battles and turf wars. The reality is roughly 5% of felons commit over 50% of the violent felonies. We went after these violent drug dealers, many of them using guns while they're committing these crimes, and we prosecuted them. Very targeted in our 13 targeted cities. We saw a murder rate in our 13 targeted cities drop by 66%. We went after these repeat violent offenders, these dealers. We got them off the street. So we started to disrupt demand, and then on the supply, we launched an aggressive public service campaign. One pill can kill. We worked with the First Lady of Virginia, Suzanne Youngkin, who also did It Can Only Take One, to really get the message out. Because one thing we saw is so many young people had no idea. For example, over 75% of the counterfeit pills that are on the street actually are laced with fentanyl. And the best way to fight bad information is with good information. So we were very, very targeted in what we did in getting into these schools. We also did Narcan training sessions as well at these schools to let these classmates know. And also, we did a lot of safety town halls at different schools around the state for parents to tell them, listen, your child's never going to be offered fentanyl. Your child's going to be offered a Xanax or a Percocet. They're going to be spending a summer party and they're going to be offered Adderall, not realizing that that counterfeit pill can kill you that has fentanyl in it. So we've done a huge information campaign. And then really the third step has been treatment. The reality is Virginia has been particularly hit hard on the addiction crisis because about 20 to 25 years ago, some of the largest pharmaceutical companies on the planet decided to treat Virginia like we were a chemistry test. They went to medical providers out in the cold fields in Southwest Virginia, and they said, listen, we have this amazing new pain pill for back pain or work-related injuries, but don't you worry. It's not addicting. It's not addictive at all. And now we know that they knew. They knew they were pushing some of the most addictive chemicals known to man. So individuals got caught in the cycle of addiction by accident. And it started in Virginia. Obviously, it went off like a bomb across the country. And so we're proud of the fact in Virginia that we went after these companies, got some of the largest settlements ever in Virginia history, over $1 billion. But that's not money that goes to us. That's money that goes to treatment. We set up the Opioid Abatement Authority, and you have record levels of amount of money going down to localities and the treatment centers to get Virginians back on their feet. Because as you know, it is very easy to relapse. We want people to go live their best life, chase their dream. Don't let addiction be a barrier to you living in this remarkable country we call home. And asking for help is a sign of strength, not a sign of weakness. The latest numbers I have is that our addiction deaths are down 40% from where they were in 2021. That is a remarkable turnaround from where we were to where we are now. We have a long way to go, but the trend lines are really, really positive.